Good morning, welcome. My name is Rabin. I'm an assistant professor at the Department of Family Medicine and Public Health, and I'm also associated with the Center of Excellence in Stress and Mental Health at the VA San Diego. I would like to welcome you on behalf of our planning committee. Thank you so much for taking the time out of your busy days and being here with us today. Very soon we are going to see a slide up there and we are going to start the day. I would like to let you know, and there is a slide about this. So we wanted to gather here to talk about dissemination and implementation science. And I think that this is a very important topic, and I was very excited to hear how many others thought the same thing. The whole idea started with my intention to invite my wonderful colleague, Dr. Raz Glasgow, here for a talk. And I was then surprised how many people reached out and said, we should make this a bigger event. We should talk about dissemination and implementation science here at UCSD. And there were people who were willing to donate their time and some of their funds to make this happen, so I am very grateful for that. The group, the planning group, identified a few different objectives for this summit, and those are listed on the slide. We would like to bring together various campus partners from UCSD, SDSU, and VA San Diego to talk about D&I. We also wanted to showcase some of the existing work that's already happening here on campus in D&I. We would like to identify any opportunities for collaboration across these different groups, writing grants together, working on different projects together, and then document any needs for further resources or opportunities to further our presence both here in the San Diego area, but also on the national agenda for D&I. So if we want to think about what would be some ideal outcomes from this summit, it would be to start to establish an active D&I learning community locally, to create more collaborations across different entities and individuals, to create also more resources, both for local and national use, and then write more and more competitive grants that are focusing on D&I or they have D&I components. And then obviously, as a result, some more publications in D&I and stronger and more ties to the national agenda in D&I. Obviously, this could have not happened without people stepping up and providing funds or time for this event. These are some of our sponsors who provided substantial financial funding or provided services for us to make this event happen, and we are very grateful for those, and you can also see this displayed all day here because they deserve that honor. We are also extremely fortunate because we have a great group of guests coming from out of campus, out of town to join us. We have Dr. Ethan Chiang from the Patient-Centered Outcomes Research Institute. He's a senior program officer there with the Dissemination and Implementation Program. He also used to lead their review process, which is an invaluable resource for us, and so please approach him during breaks as well and ask any questions that you might have. We also have Dr. Raz Glasgow from the University of Colorado. Dr. Glasgow is a professor there at the School of Medicine, and he's also the lead of the D&I program at the Adult and Child and Adolescent Program, Outcomes Research Program. I have known Raz for 14, 15 years. I was thinking about this morning, and I just feel very excited that he was able to come. And I'm very grateful to share all the wisdom that he will be able to share with you as well. We also have Dr. Allison Hamilton visiting us from UCLA and Greater San Diego VA, Los Angeles healthcare system. Allison is an amazing qualitative researcher, anthropologist. I have met her first at one of the implementation research institutes, and from then on, I followed her work. So if you want to hear about ways of feasibly and rapidly analyze qualitative data in the context of health systems or qualitative methods for implementation science, she is a nationally known person to go for that information too. We also have Dr. Brian Mittman with us. He is a internationally known dissemination and implementation scientist and brings expertise from the VA, from UCLA, also national work, obviously. And we are very happy that he was able to take some time off his busy schedule. And finally, but not least, Dr. Larry Palinkas, who is actually from town, but now at the University of Southern California. He was very closely affiliated with UCSD and still works with us. His expertise in mixed methods and a lot of other things, but I will highlight the mixed methods today. And dissemination and implementation research is another national, internationally known resource. So we are very lucky to have all of them here. Thank you. We also have obviously a lot of local experts. Some of those we were able to recruit for our planning committee. So you can see all these names up here. These people spent the past 4 or 5 months meeting weekly and working beyond to make this event happen. So thank you so much for all the wonderful, wonderful contributions and support. And then finally, again, this event would have not happened this morning if we didn't have these people come in 6:30 and also spend time here last night and the week before. And so I wanted to acknowledge Mike Daniels. He's our coordinator for the event, Sean Ryback, who is going to make sure that we have wonderful AV and IT support today, and a number of staff and students who were here early morning and helping throughout the day. Thank you. And then finally, I wanted to acknowledge that I recently moved from Colorado just a couple of years ago, and I was, throughout this process, inspired and used resources from these institutions. They have done a lot of D&I work before. Russ is one of the leads on that, and we have used some of the materials to inspire of what we are going to present to you today. So before I let the content start, I did want to show you who we are here in the room. You were gracious enough to fill out a survey, and I just assembled this information and wanted to share it with you. When we initially sent out an interest survey, there were 153 people who expressed interest in this topic. Obviously, not all of them are able to make this particular day. This was based on just one email sent out, no reminders. I was so excited. And I'm going to try not to say excited too often today, but I am very excited. We ended up having 122 people register, including our planning committee, and 22 people submitted proposal ideas for day 2. So some of you will be with us day 2, talking about some of your ideas on D&I and getting feedback from both experts and your peers. Hopefully we'll fuel some collaborations and improvement in proposal writing. There were also 12 very brave people who agreed to present Ignite presentations today. And if you don't know what that is, you will know very soon. And you will understand why I'm saying they were very brave to do that. And I appreciate that, and I am not one of them. And then finally, just for fun fact, we have about 1/3 of us who is either vegetarian or just preferred vegetarian lunches today, so we are eating healthy here. We ordered a lot of vegetarian food and also vegan. So if you look at the affiliation of the group here, this is based on our actually registered participants. Most of us are from the School of Medicine. There is a large contingent from SDSU and also the VA San Diego and some other institutions as well, as you can see, and departments. Looking at the School of Medicine departments, most of us are affiliated with either Department of Psychiatry or Family Medicine. That big chunk of other actually just said not applicable because they are not School of Medicine folks, so that doesn't really matter there. So those are the big groups, but we have representation from other departments as well. And in terms of what your primary role or position is, most of us are faculty. So today will be geared toward more research and not practice type of work. But hopefully in the future, we can also think about how to engage more practitioners and community partners in these discussions. In terms of our educational background, again, this is more of a research group. We have some great majority of PhDs, and then we have MDs, obviously. And people indicated multiple degrees, so these are not just the terminal degrees. So you see that people are also have a number of different master's degrees. The research topics that people are most interested in included mental health is a big one. Cancer and minority health are big, and I'm not surprised, of course, knowing the work here at UCSD and SDSU. Of course, cardiovascular disease shows up. What we don't see is the other, and other included things like physical activity or physical inactivity, obesity, reproductive health, and then some other topics that I cannot, geriatrics, cannot recall anymore. Moving on, we asked you to tell us in which setting you do most of your research, and you can see that we are mostly outpatient and community settings. We have some inpatient setting as well, and some colleagues are working in schools. And then the other was military, so some kind of other kind of locations. And finally, although most of us described themselves as mostly domestic researchers who are doing research in the domestic sense, we cannot ignore that there were close to 15% who did either both domestic and international work or just international work. That's going to be a big topic for D&I in the coming years, and it already is. And you will hear some work actually from the global perspective as well. And then we wanted to know how much do you know about D&I already, so we don't tell you what you already know. And we got a very difficult distribution, although fun. We have about not half, but close to half, novice and intermediate participants. And then we have a few advanced folks. So novice would mean that you have not done D&I research before, but you are interested. Intermediate, that you have engaged some, but you have not led a D&I proposal. And the advanced, obviously, is someone who would do a lot of D&I work in the past. This is our publication record in terms of D&I type of publications. 61% of the participants did not have any D&I publications, so if you don't have one, you are still at the right place. Hopefully you will have soon some. And then, again, about 30% had 5 or less, and we have the more than 52.4%. I kind of can guess who those people are in the room. And then the funding, again, 76% said that they didn't have any D&I funding. You are in the right room. And some more had proposals under preparation or review. And then here we go with the plans for today. So we have a very packed agenda. We will try to keep on time, although we started a few minutes late. And I am turning a little bit weird here because the microphone doesn't pick up, Sean, when I am turning this way otherwise. So perhaps we can figure it out for next round. So the plans are to keep on time as much as we can. Also, if you have questions, please jump in with your questions during Q&A, but we might ask you to keep them short or your comments. And I will do the same with the panelists as well. I will ask them to be concise. We try to make this more interactive if possible, but with the large group interest, it was hard to do. So the next meeting will be more interactive. We are going to have a few words from Dr. Ziedonis in a moment here, and then Dr. Glasgow is going to talk about why are we here. And then I am going to talk a little bit about what the definitions and models are for D&I. And after that, we do our first panel discussion. Everything you will hear will be mostly very high-level, overarching themes. Here are some more resources for you, how to go after this, and some question-answer examples. We are not able to get into depth. But the first panel will focus on designing for dissemination and implementation, stakeholder engagement, and D&I strategies. And then after a short break, we have the first 6 brave people presenting Ignite presentations. And then Dr. Brian Mittman, will be talking about the status of D&I research in this region and opportunities for collaboration. The lunch, we initially thought we would schedule something, but we decided to keep it open. Please stay here, and as much as you can, you will have lunch provided. Interact with your colleagues, and then also use these boards on the wall to put down some of your ideas if you are not able to share them real time. And then after the lunch break, we have a second panel focusing on designs and measurement and evaluation, another set of Ignite, and then perhaps the most important panel on funding and proposal writing. Obviously, all of these are going to feed into that throughout the day. And then a brief summary for some of the key experts here. We asked them to summarize in 5 minutes what they heard throughout the day and what some next steps might be. And hopefully you can stay for our reception, where you can, again, very casually talk with colleagues and other experts. As a reminder, for those of you who are not coming tomorrow for the proposal review session, there is a grand rounds presentation by Dr. Glasgow, which is going to be fantastic. I got to see the slides. So if you have time, please come and join us. It's going to be the Libau auditorium, and it starts at noon. A few more things. So we have coffee, tea, and water in the back. I'm sure you have already found it. The bathrooms are very easy to find. I checked out. It's about 15 seconds to get over there, so just for timing. We did provide you with a workbook. I hope that all of you were able to pick those up. These are meant to be a resource for you after the conference, but also for taking notes today. Listed some of the resources that you see here. We are not able to give all the respect to all of our faculty and planning committee, but we did provide short bios of their work here, so you can look at that. And then if you need to connect with your colleagues after the conference, we provided the list of participants, so you can easily find them. And finally, of course, we wanted to also let you know of all our wonderful sponsors, and namely all the department chairs, division chairs who contributed. I mentioned already these boards on the wall. They are really there to be filled up. We provided some markers there, so please go and write down anything you hear. Even during the presentations, you can stand up. And then we talked about the comments being concise, but please don't be discouraged and come. We will provide microphones. We would like to capture those comments as well. And then finally, almost most importantly, I don't have the right workbook here. You have an evaluation form in yours. Please don't leave without filling those out. It would be so important for us to know what you thought and how we could improve this event or future events. And then finally, we are going really high-tech here. I already recruited some of our planning committee, and they are going to tweet. We were thinking that these might be good hashtags to use, so if you are a tweeting person or a tweeter, I don't know, what do you call that? If you're a bird, please use these hashtags and put out thoughts that you hear today. Feel free to take photos of some of the slides, and then hopefully we'll get even more interest from your friends and colleagues. I think with that, I am going to invite Dr. Doug Ziedonis, Professor of Psychiatry and the Associate Vice Chancellor for Health Sciences at UC San Diego, to welcome you as well.
Well, thank you, Borsika, and let's give her a hand. We know it takes a village to put a conference together, and so thanks to everybody else who participated in putting the conference together, but it takes a great leader, and Borsika's energy is infectious and positive, and so I'm sure today will be a great day. I just want to, from the Vice Chancellor and Dean's office, say, thank you all for coming. This is going to be a terrific event. I'm glad to be part of it also. I want to also thank all of you who participated in our research strategic plan for UCSD Health Sciences, where you all really helped us put D&I also on the map and quite visible. As you know, UCSD has a very strong research tradition in many areas, and we're trying to make the D&I and health services research area much more visible. So the crowdsourcing that we did with the idea wave, and those of you who contributed really did make a difference. The public health and population health, where a lot of the D&I was discussed, was the lead group as far as input, so great job. Also, I just wanted to let you know that we submitted, or the Chancellor submitted our new School of Public Health proposal up to UCOP on Monday. So we're really excited about that. I want to thank our SDSU partner, where we have joint doctorate programs in the School of Public Health. They have an amazing School of Public Health, so we want to be like Boston, Baltimore, and Atlanta, where you have multiple awesome schools of public health in one geography, and we think we can do that. So I want to thank SDSU also for their supportive letter and our ongoing work together, which is so important. You see all the people who have contributed, the agencies and institutions. So again, thanks to within our own UCSD Health Sciences, but also SDSU, also with the VA and the Institute for Behavioral and Community Health. So thank you all for participating. I thought I would just say that I think for next year an important thing will be to see how can we partner across the campus. So Gilman's a big road, and it's sometimes hard to imagine walking across other than to go to the Price Center. But amazing colleagues over there, whether it's anthropology or social sciences, engineering, many of you already do that. So how do we bring them into this event also? I think that will further enhance, may also influence the chancellor when there are new FTEs and decisions on how those go. So colleagueship across Gilman will make a difference. So how we increase our visibility will also be important. I also just wanted to reach out to our guests and thank Russell, Allison, Brian, and Larry for coming, having outstanding, amazing experts from out of town really do complement all the internal expertise and energy. So I know it's going to be a great event, and I won't be in the way of the next presenter, but just say thank you all for coming, and I'm looking forward to how these 2 days unravel. So thank you.